What is up? I am Brooke, the founder of Bloom, and today we are going to chat about diastasis recti, Bloom style. If you have been with Bloom for a while, you may know that we talk about diastasis recti a little differently than what you may be hearing from a mainstream narrative. So, what is it? Why are we so concerned about it? And what is our philosophy here at Bloom? So I'm gonna give it to you pretty straight. Diastasis recti, or diastasis recti, however you wanna say it, tomato, is the separation of the recti muscles. So your recti muscles, your rectus abdominis, is your six-pack muscle, right? It lays on top of your transverse abdominis muscle, which is that banded muscle that we talk so much about in pregnancy and postpartum. Your rectus abdominis has a band of connective tissue that looks a lot like this Bloom mini band. And it literally goes down your midline from your sternum all the way to the pelvis. And your rectus muscle connects into this connective tissue, or this band of connective tissue. Now, a lot of the mainstream narratives out there will tell you if you are pregnant, you will have diastasis recti. And to some degree, that is actually true, because diastasis recti is just the separation of the recti muscles. But somewhere along the way, diastasis recti started translating into an injury postpartum. And what we do at Bloom is we take away that gray area and try to create an extra layer of knowledge for our moms so that you know that not every natural separation of that recti muscles that happens during pregnancy and that is fully supported by your body leads to an injury. So we talk about diastasis recti as diastasis recti and injury-based diastasis recti. And injury-based DR is anything where the weakening of that connective tissue goes beyond the natural and fully supportive stretching that simply occurs from a growing belly and a growing baby. So let's talk about that, right? What does that mean? Well, here's your connective tissue. As your belly grows, as your baby grows, this band of connective tissue naturally starts to stretch. And this is fully supported by your body. In fact, this connective tissue is so brilliant, and your body is so brilliant, that as long as you protect this band of connective tissue as it's stretching, it will and can fully come back to pretty much its original state. And what I mean by that is come back to a state where you do not have an injury. I'm not saying that regardless, you shouldn't spend the first 6 to 8 weeks in some level of rehab for your core and pelvic floor, and that you shouldn't understand how to manage and regulate your pressure as you continue to progress your exercises postpartum. But overall, what this does naturally doesn't include an injury. What can happen, and what commonly happens during pregnancy and then even postpartum, and yes, even pre-pregnancy, based on the lack of management of intra-abdominal pressure and core-based moves, is that as this band of tissue starts to stretch, and then that pressure is not managed, that pressure starts to try to escape at this overstretched point, and every time that pressure tries to escape down your midline, and it can happen down the entire midline or just at varying spaces along the midline, every time that pressure is not managed and pushes against that band of connective tissue, you weaken that point or the entire length. Again, it all depends on your body, your belly, your baby's growth, etc., your posture. But it goes back to that management of IAP. So even if you are 38 weeks pregnant and your band of connective tissue is stretched this thin, as long as you are managing the pressure that increases every time you get up out of bed, every time you go from kneeling to coming up to tall knees, getting up out of a chair, or doing some sort of more functional move like picking up your toddler, transferring a heavier weight to a shelf. Think about groceries. And then of course, in core-based exercises, when you can manage the pressure that is increasing naturally within your abdomen and not allow it to try to escape down your midline connective tissue, you are protecting and maintaining the integrity of that stretched tissue. And then postpartum, once baby has been birthed and brought earthside, the tissue starts to repair itself. Again, postpartum rehab, reconnecting to the deep core and pelvic floor, breath work, posture, all of that is going to be a part of that roadmap in helping heal this connective tissue. But you have such an easier mountain to climb when, no matter how much it stretches during pregnancy, you can manage that pressure that is constantly changing with almost every move you make. It's why we teach our moms to lift and wrap with our exhales, creating intention with every movement that we do so that we know how to manage our pressure and protect our cores, thus preventing that injury-based diastasis recti postpartum. Because the integrity of this connective tissue is everything when it comes to injury or not injury, it's so important for you guys to really understand that pressure management. So whether you're in the pre-pregnancy trying to conceive phase, whether you're currently pregnant, or whether you're postpartum, this is where you start. Understanding your core canister, understanding what pressure does, how it shifts, and how you can be in charge of managing it. It also can affect the pelvic floor drastically. So we want to make sure that those are the first steps in the building blocks to help you achieve the best core results possible, no matter where you are in your motherhood journey. I'm gonna end with something that comes up a lot, and that is a pregnant woman testing her diastasis, remember that natural separation, during pregnancy and being terrified that she already has injury-based diastasis simply because maybe she got out of bed, she noticed that pressure pushing out, thus the doming and coning down that midline, and she thinks, oh my gosh, I have injury-based diastasis, what do I do? I am not a fan of checking and diagnosing any type of diastasis during pregnancy. Why? It's simple. We all know that every pregnant woman is going to have a healthy level of separation. It happens to those with the strongest core, those with the ability to master managing their IAP, and those who have no clue. It happens to all of us. So I don't want to check it because we don't really know what the integrity of the connective tissue is until the baby has been born and we can really assess the core. And oftentimes we're going to learn more about the depth of that separation versus the width. Now, sometimes the width and the depth can tell us a lot that is similar, but the depth is more important than the width. And the mainstream narrative actually tells you the opposite. So most moms freak out. Well, I have a 2-finger separation postpartum. And then when we walk them through aspects of checking the depth, they go, well, it's not deep at all. Then you're not gonna worry about it because this connective tissue has always existed in between the two sides of your rectus, or your rectus muscle being on either side of this connective tissue. And depending on your unique design, you've always had some level of separation. Pregnancy stretches the connective tissue. It's your job to protect it. And then we get to heal it and progress our core in incredible new ways postpartum.